March and October. This could mean a record 1.27 million passengers that would travel through Canada Place. Now, in total, that's about 2% more than last year's all-time record. So yes, a lot of people, a lot of tourism for sure. All right, well, that's it for us. You're watching CBC News BC. I'm Vinny Brach. Well, stay tuned for BC Today. That's coming up in 2 minutes. We'll see you tomorrow. Have a good rest of your day.
Good afternoon. Thank you for joining us. Premier David Eby has agreed to a meeting with Alberta's Premier over this province's Safe Supply program and concerns over diversion, meaning some of those prescribed drugs possibly ending up being sold on the illicit market. Do we need better standards and safeguards? That's coming up first. After 12:30, we did push our clocks forward yesterday, meaning we lost an hour of precious sleep. Should BC keep pursuing the end of daylight saving time change? I'm Michelle Elliott. Welcome to BC Today. Thank you for joining us on CBC Radio 1, CBC Television, and live streaming on the CBC News app, cbc.ca/BC, and on the CBC Vancouver YouTube page. Well, Safer Supply is once again in the news after Prince George RCMP announced 2 major drug busts over the past few months. And they say thousands of prescription drug pills, with some allegedly from the province's Safe Supply program, were seized by their street team unit. The political response was swift, with Premier David Eby saying the majority of drugs in the seizure were not from the Safe Supply program. Meanwhile, Alberta Premier Danielle Smith has called for an emergency meeting between federal and provincial ministers to prevent drugs from entering her province. We're asking for your thoughts on this. Do you think there are better safeguards needed for BC's Safer Supply program? Are you concerned about diversion of prescription opioids? You can give us a call, 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. You can also email bctoday@cbc.ca. We'll take your calls in a few moments. But first, joining me is Jules Boudard, former Prince George frontline worker and OPS manager. And she's now pursuing her master's in social work with UNBC. Hello, Jules. Good afternoon.
Hi, thanks for having me.
Thank you for joining us. The Prince George RCMP statement said their unit seized illicit drugs such as fentanyl, cocaine, and methamphetamine, and they also seized prescription drugs. I'm wondering what your reaction was when you heard that news.
I find it really disappointing how politicized this issue is being, and the fact that the Prince George RCMP has pointed out safer supply as being the source of these problems, when the small number of prescriptions in the province and especially in the north, like could not equate to thousands of pills being seized, when it is just a few hundred people collecting them every day. And as someone who has managed overdose prevention sites, I do see people come in and use their safer supply. And as someone who has managed staffs of like low barrier workplaces where people who use drugs can work there, like there's quite a difference in people who are using, let's say, their methadone and prescribed safe supply and people who are still using the illicit street supply. And it's really disappointing and a distraction from like the real problem, which is that fentanyl is killing 5 people every day in our province. Like if you look at the coroner's report for 2023, you see fentanyl present in 84% of deaths, and hydromorphone is present in 3% of deaths and usually co-occurring with fentanyl. So we're not seeing that hydromorphone is killing people at all. Like none of us want to see kids using a bunch of opioid pills. That's not healthy, but that's not what the coroner's report is saying. That's not what the child and youth advocate is seeing. We do know that diversion does happen. I've been quite open about how diversion has kept people close to me alive while they waited to go to treatment or to access Suboxone.
Hmm.
I think that there are ways that you could reduce diversion. For instance, we saw a huge rise in benzo presence and deaths last year. A lot of people are really struggling to access benzo tapers. Withdrawal from benzos can cause seizures and kill you. So when people can't access a benzo taper, they're stuck in accessing the illicit supply. Um,
So it sounds like you're acknowledging that diversion has occurred, but to what extent it's a problem is the question.
Yeah, exactly. And I think that it's like quite exaggerated because now we're hearing, these opinion columns saying like every single person is selling their supply and like that's just not what we're seeing. And as people who work in community with other drug users, like we know that people are using their own safe supply. And we also know that people are forced to keep accessing the illicit supply and are like trading or selling some of it. I think that there are ways that safe supply could be improved. Like hydromorphone tablets don't work for everyone. Um, Access to it has gone down. Right now, only just over 4,000 people in the province are accessing it. And when you consider that over 100,000 people in the province are diagnosed with opioid use disorder, that's quite a small amount. Uh,
And pardon me for jumping in, Jules. I just wanted to ask you what, if anything, should be done. You were mentioning something should be done about diversion. When the provincial health officer released her assessment, her review of the prescribed safer supply program, she said that some diversion is occurring. However, the extent and impacts are unknown. And she wrote in her report, diversion to people at risk of drug poisoning may be of benefit, while diversion to people who would otherwise not use unregulated drugs is harmful. And so I'm wondering, what, if anything, do you think does need to be done then to provide some kind of safeguard against what she says would be harmful effects of that?
Yeah, I think diversion shows that needs aren't being met. So there are people that I have seen who are trying to access diverted safe supply. They're normally people in their 40s, 50s, and 60s who have tried methadone, tried Suboxone, been to treatment several times. And because of patient caps at different clinics in Prince George, they haven't been able to access their own prescribed
Mm.
safe supply.
Hmm.
Um, like fentanyl patches can be something that works better for people who are addicted to fentanyl. But in order for that to happen, you need to have clinics that are open more days of the week because they need to be changed every few days by a healthcare worker. Um, an IOT clinic was planned for Prince George 3 years ago. They expanded the clinic that we all know as the Needle Exchange and hired staff for an IOT clinic. And then I'm not sure, but it just never opened. That would be so people accessing like a safer injectable form of hydromorphone under supervision. So there's no way to divert that because they're using it right there in the clinic. Um, so I think that needs could be met. And then like as I mentioned before, I think that like benzodependency really needs to be addressed. We've heard that people aren't even being accepted into detox when they've shown signs of benzos. Across the north, like access to oat at all needs to be improved. Prince George is the only place that offers detox in the whole north, so people have to travel, which can be more than 8 hours on a bus
It's kind
to
of a
get to.
hub, isn't it? Yeah, for those
Yeah.
services.
So I think that like I just don't see people treating this like an emergency, not like allocating time and resources to this. And then like if we want to stop addiction, we need to stop trapping people in poverty and stop killing all our friends. When I see people relapsing, it's because someone close to them has died and it affects them quite greatly. And it's, you know, this all started in 2016. Like all of us working in this have like lost countless people over and over and over. And it's like having just quite an effect on people. And I think that the first priority should be removing people from being dependent on organized crime on the illicit drug supply. And then
Okay.
once people are stabilized, they will be able to access, trauma counseling, like different other services. But because of how volatile the street supply is right now, that makes it quite difficult when people are trapped in that.
And so you talked about, the politics of this. Prince George RCMP, they announce the results of a drug bust, and they tell us, where they believe these drugs came from. Although they're not able to clarify how much of it at this point. We did follow up with them this morning, but what to you is the political rhetoric around this?
I think that people like they're trying to be divisive. Like to them, it's like common sense. Don't give drug users drugs. And that wasn't common sense to all of us. But when I was working in the downtown east side and the Crosstown Clinic expanded and they were able to accept more clients, like when I saw people access prescribed heroin, like, oh my God, like for some people the difference, they were just like went from living quite chaotically to living like pretty stable lives, like within a matter of months. And that really changed my opinion on it. And, opioid dependency it's a quite physical dependency. So just people need access to different options and people have access treatment in the past over and over and over again. Like I'm not, and I will do any treatment referral. And I'm quite excited about the healing center being open by Carious County Family Services in the north. Like I think that will be an amazing healing center. Um, but I just think working together to offer like an array of resources to help people get out of this like loop, help people from being preyed on by organized crime.
And so where do you think, what do you think of what politicians have had to say then about this?
Well, they are just saying like it's common sense to not give people drugs, and I think that they are often like conflating or implying that, or even calling like David Eby's program, like we had Safe Supply before Eby, like do we call it John Horgan's program? Like, um, it these programs are like developed by like expert doctors like in our community who have been working in our community for decades and seeing like what works. And I think that they're just sort of like relying on people's ignorance around the topic to make it seem like these very, very small programs that very few people access are making things worse when it's just more people are unhoused, more people are using the illicit supply. Things are getting worse, but not because of these like very small programs, which we've shown benefits from.
Really appreciate hearing from you this afternoon. Thank you so much for your time.
Okay, thank you so much.
That's our guest, Jules Bouda, a former Prince George frontline worker and overdose prevention site manager. She's now pursuing her master's in social work with UNBC. And we're asking you as well for your thoughts on this. Do you think that the Safer Supply program has risks of diversion? How concerned are you about that? You can give us a call, 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. By email, it's bctoday@cbc.ca. And Randy is joining us from Vancouver. Hi, Randy. Good afternoon.
Hi, Michelle. Thank you for taking my call.
Sure.
This is an absolutely enormous crisis that I think we, including your guest and people like myself, I've advocated for improvements in mental health care and addictions for over 25 years. I've sat on various boards and committees. I'm on a committee at the BC Centre for Substance Use with family representatives.
Okay.
Everybody has a different opinion or suggestion. And I think doing the same old, putting stronger narcotics out onto the marketplace on the street is not going to work. And, even Bonnie Henry identified that. And to some extent, the coroner in her latest report, that they don't have data on supply that's been diverted. And yes, is always going to be diversion. However, are people with severe opioid addiction, is that cohort increasing or decreasing? I've heard it's increasing. And I've heard numbers 5 years ago of 40,000 severely addicted people. Now I'm hearing 100,000. I've heard higher numbers, and people are still dying.
So does that make an argument for keeping more of those people, as many as we can, alive, if more people are struggling with severe opioid addiction?
Well, there's a very difficult decision, Michelle. Are we keeping people alive or are more dying? And then I live in Vancouver. I have a child in high school, and I want to see more prevention. I really do, because I think we're almost in our destigmatizing campaigns, which are great to a point. I think we're almost normalizing driving by and your kid looking out the window of the car and seeing, a very poor person, unhoused, smoking fentanyl or putting a needle in their arm. And you see that in many, many neighborhoods in Vancouver right now. And I'm not being alarmist, but I grew up here. I think we really have to dial this back and say that's not the way that our medical system should be treating this. And the Controlled Substances Act, federally, and I've been involved in this since the supervised injection site in the downtown east side.
Okay.
The Controlled Substances Act is just that. These substances should be controlled with pharmacists involved, not masters of social work distributing the drugs and assessing. I think that's something. It's a hard conversation, but we all have to sit at the table and have
it really is a hard conversation. I really would like to know, Randy, you are a family consultant or a representative advocate with the BC Centre on Substance Use. Can you share a little bit about your own experience?
Well, without getting too personal.
Sure. Yes, absolutely.
My own experience, I have a family member who continues to struggle with addiction to various drugs. My late mother suffered from bipolar illness all her life. I've seen people apprehended, family members, and committed to care, which is a very, very messy situation, if I can use that term. However, it's necessary sometimes. And that's another discussion with, mandatory care. My late brother was also the first serving police officer in North America to advocate for decriminalization. But he was talking marijuana at the time and, compassion clubs. And, marijuana has never really killed anyone that I'm aware of. These are much different drugs.
Yeah.
And, the other last comment I'll make, in distributing narcotics on the street or whatever the drugs are, my real concern is people suffering from mental illness on the street that get access to these without a prescription, without supervision, without a medical assessment initially, and now bang, they're addicted or dead. And that's something I think we all have to step back and realize that this is not a, and I'm talking about the most marginalized people in our society. That we see
You sure are.
unhoused.
Randy, I'm going to jump in. Thank you so much. I'm sorry to jump in. I just have Eric
problem.
and Victoria waiting. I really appreciate hearing from you, and thank you for sharing as comfortable as you were, to the extent that you were comfortable sharing your personal connection to this. Really appreciate hearing from you. That's Randy in Vancouver. Eric is on the line now in Victoria. Hi, Eric.
Hi, thanks for taking my call.
Yes, thanks for calling us. How are you? How concerned are you about this diversion issue?
The diversion issue is unfortunately a very minor solution to a huge problem. Personally, my stepson has been, he's addicted. He's one of the people that you're talking about. He lives in a vacant home from whichever vacant home he can find.
Yeah.
So he's got mental illness problems. And he's been on multiple waiting lists. We've gone so many times for rehabilitation, rehab, help from anybody. There is no help out there. For the majority of people living on the streets who are drug addicted, they are not going to get help. If they get the drugs that they seek so desperately from a supervised site, well, good on them. That's the best thing that's going to happen in their lives, because the government has failed us dramatically for any kind of support system for people out there who are living it rough. It's a terrible situation. We spend all this time debating about whether they should get clean drugs or bad drugs from the street, when what we should be doing is getting more nurses, more rehabilitation places, more counselors, more people to take in the people that are stranded at the edges of our society. It's a total disgrace on the compassion of our society, and the diversion system and the small measures that are being discussed now will do nothing to save the people who are living rough.
So the Safer Supply program, do you know if your stepson has been able to access that in Victoria?
I don't know if he's been able to access it. I suspect he gets it from the easiest source possible. That's typically the way these things go.
Eric, I'm sorry that your family's going through that. Thanks very much for calling in.
Yeah, you bet. Yeah, we just wait for the phone call. We know it's coming. We just don't know when.
Wow. That's a heavy thing to carry. Eric, thank you so much. That's Eric in Victoria. Joining us now is BC United MLA Eleanor Sturko. She's the provincial mental health and addictions critic with BC United. Good afternoon. Hi there, Eleanor Sturko. Can you hear me?
Yeah, can you guys hear me?
We can
Sorry.
now. No, that's
okay. Awesome.
We can hear you
I
now.
don't want to miss out on this important conversation.
It
Thank
really is. What are your thoughts on this? The RCMP in Prince George reporting that there's an amount within the drug pills that they have acquired that is from the province's Safe Supply program.
Well, I'm glad to see this information coming forward. And you know, it's true. I think we need to recognize that not the entire seizure, of course, was
Yes.
believed to be safe supply. Some of it was believed to be other pharmaceuticals obtained. Some of it was believed to be, you know, drugs that were manufactured by the gang. But the fact that there is some safe supply there is a concern. But I feel a sense of relief that this information is going public, because to be honest, it's only sometimes through this type of pressure that changes can be made. And if you'll allow me, I just wanted to clarify. I've been listening in. It's been a very great conversation. But the guest that I listened to that said that opposition members want to remove the ability for people to get prescriptions, safe supply. So we are actually we have recognized from the beginning that there's a role for prescribed pharmaceutical alternatives, or, you know, safe supply. And before COVID, it was actually a witness program. And during COVID, there was risk mitigation guidelines put out, and that's when we started to see prescriptions being handed out that would allow people to take multiple tablets, you know, sometimes as high as 28 or 30 pills being taken away. We want to go back to that. We don't want to stop people from getting medications and being able to be stabilized and titrated over to treatment medications like Suboxone. But we believe that it's important especially
Okay.
given the risk that we have more safety.
Ms. Turco, I'm just going to pause for a moment. We do have to just pause for another item, but I will come back to you after the news update. Is that okay at 12:32?
You got it.
Okay, I appreciate that. And I know that this was a bit of a late request as well with you. So I appreciate your time. BC United MLA Eleanor Sturco. It's 12:28, 1:28 in the Mountain Time Zone. This is BC Today. We will go back to our top story in just a few moments with Eleanor Sturco. Another story for you now from Haida Gwaii, and a boys basketball team has made it to BC's High School Basketball Championship Finals. Here's CBC's Janella Hamilton.
For 17-year-old Levi Burton, playing basketball on a provincial stage is a dream come true.
I don't even know how to describe the feeling. Like, it's just something I've never felt before. Like, just knowing that this is the furthest any team has ever made it. Like, just knowing we've already made history.
The coach of the Gitgalang Kuyas Breakers says this is the first time ever a boys sports team from as far away as Haida Gwaii has made it to the championship finals.
Representing Haida Gwaii is quite crucial to me.
Burton, who is from Skidegate, says the island communities often host tournaments as a way to connect and socialize.
It brings everyone from the small island of Haida Gwaii together, and it's just really beautiful, like how we just connect as a family through the game.
It's a long-time tradition for the close-knit community that dates back to the dark period of the residential school system.
There's a long history of basketball on Haida Gwaii just through Skidegate Saints and through culture at the same time, right? It was brought back from residential school through residential school survivors, because when they abolished potlatches, they created this tournament called the All Native, and the All Native was a gathering point for families and friends.
He says basketball became one of the only ways for Indigenous people to gather during that time. In crowds. In the end, it was a heartbreaking 3-point loss to Chilliwack's Unity Christian team. The Breakers visibly emotional, but in good spirits.
This is BC Today here on CBC. Thanks to Janella Hamilton. And for that report, we're going to go back to our conversation about safer supply coming up with Eleanor Sturco. Right now, it's time for a CBC News Update.
And the provincial government is promising... Good afternoon. The provincial government is promising a new acute care tower at Surrey Memorial Hospital. The province says over the next year and a half, the project will go to the business planning phase, but the new tower is still years away. The RCMP and Prince George are dealing with what appear to be two separate homicides over the weekend. The latest was yesterday when a woman was found dead inside a home. Earlier in the weekend, a person was found on a forestry road. Police say that death appears to be an isolated incident. A 19-year-old from Kelowna has died after getting caught in an avalanche in Alberta. The man was buried under the snow after getting caught in the slide while skiing in the backcountry in Kananaskis. Another man was able to escape by digging himself out of the snow. Meanwhile, North Shore Rescue says a woman is lucky to be alive after she was caught in an avalanche and buried upside down for about 20 minutes. The woman was snowshoeing with a companion on Mount Seymour yesterday. Rescue crews say at the time the area was rated as high danger terrain with human-triggered avalanches very likely. And now the forecast wind warnings are in effect for Greater Victoria and the Southern Gulf Islands. Gusts up to 90 kilometers an hour are expected. On the north coast, mainly cloudy and windy this afternoon with a high of 7. Highs to 6 with a mix of sun and cloud in the Peace. In the central interior, including Prince George, a high of 7 and mainly cloudy. Highs to 6 and cloudy in the Kootenays. In the southern interior, including Kelowna, a mix of sun and cloud with a high of 9. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, periods of rain this afternoon, windy in some areas with highs around 8 degrees. That's your CBC News Update from Vancouver.
Thank you very much, Rob.
You are welcome, Michelle.
That's Robert Zimmerman in the CBC Vancouver newsroom. Welcome back. You're with BC Today here on CBC. And we have been talking about the Safer Supply program in this province. And BC's Premier David Eby says that he's willing to meet with Alberta Premier Danielle Smith, who has expressed concerns and asking for an emergency meeting around the issue of safer supply, the program here in BC. Now, it's back in the news because Prince George RCMP announced a couple of major drug busts over the past few months, and they said that thousands of prescription drug pills, with some allegedly from the Safe Supply program in BC, were seized by their street teams unit. We've been taking your calls. We'll go back to Eleanor Sturco in just a moment. And emails are coming in as well. Joanne writes from Victoria, whenever governments bring in new programs, they need to continually tweak what works and what doesn't. Every BC government has failed at the, quote, pillars of support for those in addiction. And if they took it seriously, this problem would be shrinking, not growing. Nina writes in Souk, instead of supplying drug users with everything they need, we should supply productive members of our society. Those who don't have a family doctor cannot afford their meds or housing. And Jesse writes, if prescription drugs are found where people are buying their drugs, is this not the definition of safe supply? Why are some people deserving safe drugs and some should only be able to buy likely poisoned drugs? Prohibition has been shown not to work. Thanks so much for your emails. bctoday@cbc.ca. We're joined by BC United MLA Eleanor Sturco on the program to talk with us about this. She's the mental health and addictions critic for BC United. And thank you so much for being with us again and for being patient throughout this hour. You were talking about what BC United's stance is when it comes to the Safer Supply program.
Correct. We'd like to see this go back to a witnessed program and to become really, truly recovery oriented. So this means that we want to make sure that people can be stabilized and that doctors can still prescribe medications as they're needed, but that they put in more safety measures to ensure that these drugs aren't being diverted or used as currency to buy deadly street drugs.
When the Prince George police, RCMP, made their announcement, Kevin Falcon, the BC United leader, posted on X, formerly Twitter, the NDP refused to admit diversion of publicly supplied addictive drugs was happening. Now there's proof. NDP policies are failing British Columbia and people are paying the price. BC United has a better way to tackle the addictions crisis. And he says in this video post, our approach is free treatment, not free drugs. So what would the approach be from BC United?
So we have a platform piece of policy that we actually announced last February. It's called Better is Possible. It will make treatment and recovery free for all British Columbians who need it. This doesn't mean that we will prevent doctors in any way from continuing to prescribe medications, but we would like to see a witness program. So the Safe Supply program, as it is currently being run under the risk mitigation guidelines, would not be the same. We wouldn't be doing that. And we would be recovery focused, similar to what Alberta is doing. They also have a program where they use prescribed alternatives to help stabilize people. But it isn't a never-ending process where you can continually keep going forever and ever in this way. It is recovery-oriented, meaning that they come up with a plan with the physician who's prescribing to try to get that person onto other medications, so like Suboxone and Sublocade, so that they can be stabilized, they can be pain-free, and that we can get them onto their pathway to recovery. One of the biggest financial barriers really is for people in the middle class. And that's where we have the largest amount of people who actually are dying of overdoses. In my health authority where I live, that's the majority of people who are losing their lives to, this drug crisis. But if you are low income, there's a chance that you'll be able to get treatment or recovery paid for. If you're very wealthy, of course, that's not a barrier for you. So we really think that we'll be able to help more people by, making it so that there isn't a financial barrier there, and then doing sort of something that the government just announced last fall, which is they're funding 180 beds that were currently beds in the private sector, and using basically a surge capacity funding to fund those beds and allow people to go there free of charge. Could have been done 7 years ago, and this is
Okay.
similar to what we would do, only on a larger scale.
Dr. Bonnie Henry, I'll just point out, when she released her assessment of the Safer Supply program, actually recommended it broaden the availability, despite acknowledging that diversion was an issue. I want to ask you something. You were responding to our earlier guest, Jules Boudreau, who also said that politicians are inflating the effect of this small program, as she called it. I wonder what the effect of the political rhetoric might be. There was an email that we received, Nita, who wrote, instead of supplying drug users with everything they need, we should supply productive members of our society. I wonder if political rhetoric is just contributing to stigma against drug users.
There's a lot of things I would say to that. First of all, I'm very proud of the work that I've done as the critic for mental health and addictions. Because if you think back a year ago, people in this government denied that there was any diversion of drugs. In fact, they called it an urban myth. But, when Bonnie Henry did her latest report, February 1st, they had to actually acknowledge the fact that diversion is real. It's actually, characterized in her report as being common, and that diversion has population level harms. So my work to bring this forward, to make sure that people understood that this was a reality, and the information that I get came from frontline addictions physicians. I didn't, make this up in some sort of vacuum of politics. It's my duty to be a critic, to raise things that sometimes are uncomfortable. One of the things that I'm really concerned about is that we have seen some changes in our province as a result of the drug crisis, and even potentially exacerbated by decriminalization. And it's the open drug use that has a lot of people upset. And I do believe that what we've been going through as a province in terms of people seeing, you see the videos online of people using drugs on the SkyTrain or in, Tim Hortons or in Starbucks. That in and of itself makes people angry. It increases the amount of stigma because they are feeling angry at the person who actually has a medical problem. So I don't think that, me as a critic raising something that is a concern needs to be studied. I'm proud that as a result of those concerns that I raised, we did see action. I think that if I had not come forward to say, diversion, I'm hearing that diversion is a problem, I'm not sure we would have seen that report from Dr. Henry. So I have an important role to play as an elected official with my portfolio as a critic. I certainly hope that I'm not, in any way causing harm. That's definitely not my intention. But if I don't say when there are problems, especially with something as important as, giving people very powerful opioids and the fact that they are getting out into the population, I'm not doing my duty. And that's dangerous as well.
Ms. Turco, thank you so much for spending the time with us this afternoon. Really appreciate it.
Yeah, thanks for involving me in this very important conversation.
It is. That's BC United MLA Eleanor Sturco, the critic for mental health and addiction. It's 12:41 now, 1:41 in the Mountain Time Zone. You're with BC Today here on CBC. We are taking your emails on that topic as well, bctoday@cbc.ca, and we'll put that together for you for tomorrow on the program. 12:41, 1:41 in the Mountain Time Zone. Well, yesterday morning, our clock sprang forward in BC, and the annual spring forward time change was back, and that's despite plans to end it. That began, 4 years ago now. Back in 2019, the NDP government took steps to end the time change and move to staying on permanent daylight saving time. Now, that was after 93% of British Columbian respondents said they supported the change during public consultation. Well, here we are. We are still changing our clocks, and we lost an hour yesterday. We're asking you, how is that time change affecting you and your sleep? Should BC just keep daylight saving time and that change at this point? You can call us 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. We're going to speak with a sleep expert as well in just a few minutes. Right now, CBC's Nicole Out has been looking into this and why we are still changing our clocks. She's a CBC journalist based in Prince George. Hi, Nicole.
Hi, Michelle.
Thank you so much for this. It really feels like time itself has stalled on this proposal. Why have we not made the actual switch that was promised 4 years ago?
Yeah, well, it is a little bit complicated, as most interesting stories are. And I do want to just mention that there are many good reasons, important reasons why people are looking at ending that twice a year change in time, because even shifting by an hour can have real health consequences, whether it be heart attacks and increased risk of heart attacks. As well, it can increase depression, and there's even more car accidents that can happen. And so the other part of it, there's actually already a number of communities, so communities in the Peace here in the north, as well as Fort Nelson, that actually already observe one time. So they're kind
Right.
of currently on mountain time, which is what would be daylight saving specific. So there's ample evidence that this might be something we want to look at. And with that, in 2019, as you mentioned, the province was looking at making that change. They went to the people, and the overwhelming choice was to go to daylight saving. And
Right.
ultimately, they did pass a bill that said that, okay, that's what we're going to do, except we need to wait for Washington, Oregon, and California.
Right. And so what have we heard from those states?
Yeah. Well, in 2019, it seemed pretty straightforward. It seemed like, yeah, everybody was on the same page. We're all going to be moving towards that change. However, while those states, so while they were looking at making the change, there was one thing in the way, and that's the fact that they legally cannot actually adopt year-round daylight savings.
Okay, so as much as they want it, they have to wait as well. Everyone's waiting for each other, and that's because there needs to be a federal change, right?
That's right. And so states on their own, no matter how much they want it, they just can't make that change. So there have been efforts in Washington, D.C. to make that change. Senator Marco Rubio actually introduced legislation to adopt year-round daylight saving across the entire U.S. However, that stalled in the Senate and in the House. The most recent attempt was in 2023. And so, those states, they want to make the change, but they don't really have the ability. And so some of the representatives in those Western states, they're looking at something a little bit different. They're now looking to adopt year-round standard time. So that's the time that we just left. What we would have in the winter. And I talked to one of the representatives. So Mike Patton is a state senator in Washington. He's the one that introduced legislation to make the change there. And he says adopting standard time is a bit of a compromise.
I prefer the year-round daylight time. I'm kind of a sports person, especially baseball, and have organized baseball tournaments in the past, so I like that extra hour of daylight. But despite that, I would prefer year-round standard time over switching back and forth twice a year.
It's the switching.
Senator Pat, well, exactly, right? Like, it might not be what we wanted, but at least we get a consistent bedtime and
Right, exactly.
wake up time throughout the entire year. So it didn't actually pass. It was before the legislation, before the Senate, earlier this year, and that session closed last week without it passing, but he thinks it's going to come up again. And there would be a clause likely that if things did shift at the federal level in the US, those states would go to daylight saving. But as it stands right now, the most way forward would be to go with that year-round standard time.
Okay, Nicole Aud is with me, and I'm going to ask you in a couple of moments then what would happen with BC if that did take place down south. Nicole Aud, CBC journalist, who's been looking into why we are still changing our clocks 4 years after the BC government took steps to go to permanent daylight saving time. And we're taking your calls. How has the clock change affected you today? I know I felt a little bit sluggish yesterday for sure. And should BC just stick with the time change as it is. 1-800-825-5950, 604-669-3733, pound 690 on your cell phone. Suzanne writes near Nanaimo, I'm very upset that so many people think we in BC should stay on daylight saving time. Standard time is the standard. That is the name. Our time is dictated by the prime meridian that runs through Greenwich, England. Our time zone is Pacific time, which is 7 hours behind Greenwich, and there it should stay. I sincerely hope that our beautiful province of BC does not and never will follow the lead of our misinformed neighbors to the south. Marjorie writes, since the time of the survey of BC's population, scientific studies have shown that keeping standard time, not daylight savings time, is healthier. It is better to have more light in the morning than in the evening, but anything is better than changing twice a year. She's basically just with Senator Patton there, Nicole. I want to introduce now as well someone who can talk to the sleep part of this. Adela Tsuan is owner of Sleepy Baby Coach, and she joins us now. Hello, Adela.
Hello there.
Thanks so much for being with us. How do you see the change that took place yesterday, us bringing our clocks forward? How do you see that affecting our sleep?
Well, thanks for having me, Michelle. I mean, when it comes to sleep, any time change is going to drastically affect our mood, how well we welcome our day, and how we're going down at night. So I got to say, twice a year when this happens, it does take a big impact, not just for adults, but for children alike.
Oh my goodness. What is the impact on children and to adults?
Yeah, well, I mean, with adults for sure, we're going to see increased fatigue, irritability, difficulty concentrating. I mean, whether working, it's quite the challenge when you're running low on sleep. Children are even more sensitive. So imagine you and how you're feeling a bit more groggy. It's definitely going to be affecting children even more because they are just even more sensitive to changes in the routine, and they do struggle to adjust to new schedule.
I guess they don't have the benefit as well of, having that warning days before and sort of trying to prep themselves.
That's right. They don't know what hit them, and when they're being woken up at a time, or they're trying to go to sleep, their parents are trying to usher them to go to sleep, and they're like, "What? I ain't tired. It's not my bed." I mean, you try going to bed an hour early, and you'd be kind of beside yourself, thinking, "What am I doing here?"
I have tried, and it's worse because the pressure just makes it even harder. Let's take a call now. Our numbers again, 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. Rob is on the line in Vancouver. Hi, Rob.
Hey, how are you?
I am just fine. What are your thoughts on the time change and how it's affecting us?
Well, I don't know. I personally have never been affected by switching back and forth. It's no big deal for me, but I appreciate it is for other people. I'm going to echo some other emails you got. I've read articles about this on CBC that the experts, say we could stay on standard time because it's the darkness in the mornings that leads to this, uptick in car crashes during the morning commute. So I think we should stay on standard time year round, and then, the sun will be at the highest point in the sky at noon. And when we think about it, it's kind of funny. We like daylight savings time because it gives us more daylight hours after work, let's face it. So all we need to do then is be on standard time and work 8 a.m. till 4 p.m.
I love it.
Or 8:30 p.m. till 4:30 p.m. Like we don't actually, it's like we think it has to be 9 a.m. that we go to work. I mean, it's just a bit of a construct. It's not this objective thing. A final thought, many studies have shown that a 4-day work week doesn't reduce productivity. So why don't we go to standard time? Why don't we work 9 to 4 year round? I bet you there will be no loss in productivity, and also safer in the afternoon commute during the dark portion of the year, because we'll actually still have some daylight, and there'll probably be less crashes, and society will save money on all the costs that car crashes bring.
And 4-day work, and you're advocating for a 4-day work week as well.
Well, yes, I am. But my bigger point was, if a 4-day work week doesn't reduce productivity, then surely going to a 7-hour workday won't either. So we could do 5 days a week, 7 hours a day, work 9 till 4 year round, be on standard time, and we'll get an extra, hour of daylight that way as well. We don't need to change our clock.
What a neat idea that it's actually the hours of daylight after work that's the issue. And so why not just shift our work hours? I love it. Rob,
Yeah,
thanks.
that's why people like daylight saving time.
Yeah.
That's the only reason, right? So.
I wonder if that is. Rob, thank you so much. Really great to have you. Maurice is next in Prince George. Hi, Maurice. I understand you're an astronomer?
Yes. Yeah.
Wow.
And so it makes a difference for me personally, but I think the bigger picture is the cost to our medical costs of sleep is probably one of the most valuable things we have. If we're reducing that or hampering it for a good portion of the year, it's costing us all of us money in our medical costs, just for for just the day-to-day wear and tear that we have to recover for every night. And it's unfortunate it was not even offered as an option when the province provided that voice that we
public
could have.
input, yeah.
Yeah. So, I do have personal reasons, but I think that is more significant. That are the costs that everyone has to bear, that we're not as healthy as we could be.
And Maurice, as an astronomer, is there anything that you can tell us? Is there any, I don't know, can you tell us a little bit, is there a link at all to the time change, just to daylight saving time?
I think the most significant thing for all society is our connection to the universe. If we have fewer evening hours, those are the hours where most people will be able to go outside and look up at the stars and the planets. If it's much later or an hour later, there's fewer and fewer people. We up here in Prince George, after the end of April, stargazing is almost completely done for the year because it's too bright, too late. You're looking at past 11 o'clock or midnight before it gets dark enough. And if more people can actually see the night sky and understand our place in it, that enriches all our lives and our understanding.
Oh, I love the philosophical bent. Thank you, Maurice.
You're welcome.
That's Maurice in Prince George. I would love to get a reaction from our guests here. Adela Suen, owner of Sleepy Baby Coach. We have someone saying, adjust work hours, you get more daylight time. And another caller saying, well, it's, a standard time is healthier for one, but also look at think about the time that you have to stargaze. From your perspective, is there a healthiest option when it comes to sleep?
Well, when it comes to sleep, the healthiest option is to be able to maintain some sort of routine and predictability. And adults and children alike do thrive the best on that. And we do end up falling asleep and staying asleep better because of that predictability. The problem with daylight savings right now, it's creating unpredictable, and forced changes into our schedule, and may not be necessary. And as a result, for the temporary days following the time change, it does cause quite the havoc in everybody's schedule. And just think of adults having that trouble, but if there's adults with children, that issue is magnified and multiplied.
So Nicole, if the states down south did make those changes, would BC follow suit?
Well, that was my question as well. So I did go to the province and I asked, the whole point of delaying any sort of changes to stay connected and in line with what's happening in those western states. And I received a comment from a representative for the Ministry of Attorney General. They said ultimately they're just observing and seeing what happens. So don't have a great answer.
Still just observing. I feel like I'm caught in a time loop. Danny is up next in Richmond. I just have a less than a minute, Danny, but go ahead.
Okay. Hi, calling from Richmond. Yes, I think that the time change, I have sympathy for the parents with little children and so on, but life is full of changes, and if we don't practice with little changes, we won't be able to make big ones. And this 1 hour, twice a year, forwards, backwards, I think is a good little exercise in practicing changes and living with it. So it's an adventure. Plus, I've traveled internationally a lot, and 10 time zones, 5 time zones, I've recovered pretty quickly. So I don't think we should
Any
make too much
tips?
of it.
Quick, in 10 seconds, any tips?
Any tips?
Yeah.
I don't know. Yeah, have a little nap the first couple of days if you get a chance somewhere for 10, 15 minutes and go with it.
Just go with it. I love that perspective as well, Danny. Thank you very much. What a range of thoughts and views we've had on the show today. Nicole Out and Adela Swen, thank you so much for your time.
Thank you for having me.
That's the CBC's Nicole Out from Prince George, and Adela Swen is owner of Sleepy Baby Coach. BC Today at cbc.ca is our email address.